Cancer Holistic Guidance, Part 21. Dr. Dilip Gadgil, Pune. So, I was telling you about the acute leukemia case. The patient had no chances of recovering and his financial state was in the doldrums. The oncologist had already told the patient that there was no use of spending money on treatment. In that situation, we could have tried to do something. I have him medicines for 2 days and asked him to come to TMV, where free medication was available. However, he didn't come. His brother admitted him to the same hospital again. They kept him there for 10 days on saline and basic food. His brother then collected donations and spent 30,000 rupees on getting 1 chemotherapy injection. 5 days later, he died. At his funeral, I mentioned that the patient had survived 15 days without any treatment. Do you even differentiate between giving treatment and not giving treatment? Whether the treatment works or not is secondary, but not giving treatment is a sin, especially when we had given him a treatment option. But his family believed that allopathy was the only form of treatment, despite allopathic doctors saying that they couldn't help. People contributed money so the chemotherapy could happen. From our perspective, giving medicines and milk was a good treatment method. But nobody thought about it that way. People call allopathy a science, but they aren't so sure about Ayurveda. For them, using Ayurveda in conjunction with allopathy is still okay. But solely relying on Ayurvedic treatment means keeping the patient away from scientific treatment. This is the prevalent mindset. When the allopathy doctor himself is saying that chemotherapy is futile, what is the point of still going ahead with it? Let me tell you about another similar case. This time, it was a case of non-Hodgkin lymphoma. The patient's liver and spleen had enlarged and become stone hard. Again, allopathy was going to be of no use. I kept him on a milk diet and gave him medicines, to which he responded quite well. The size of the liver and spleen reduced and after a month, it came back to normal. His son told me that he was taking him to another city for further treatment. I told him to stay here in Pune so I could help the patient better. He said that while he knew allopathy wasn't going to help and that my medicines had shown good results, his family reckoned that he was killing his own father by opting for Ayurvedic treatment just to save money.